talk about the importance of governance. I mean, there was a study that showed, I think about 61% of hospitals are checking their predictive models for AI for accuracy, which means 4 in 10 are not. So, how
Mm.
much do hospitals and health systems need to be paying attention to not just deploying these technologies, but having really rigorous analysis to make sure that these technologies are accurate and aren't contributing to patient harm?
What we often don't ask is how was that AI developed? What is the testing pool? Is there an intrinsic bias in the testing pool? Because if you tested on healthy young white male and then apply it to in an urban setting, and then you apply it to rural, um, you know, Latino man, elder in the countryside, that might not be very applicable. And so this is where, we have advocated for AI to have sort of like a nutrition list, right? When you think on your packages in the supermarket, you can look what's in there, and so we're proposing that for AI, so that some key factors like what was the study pool, what was the statistical method, was how extensive was the testing done, is it open, is it closed, all those things which today many don't know. And the second one we're really concerned about is that AI has sort of woven its way into a lot of applications where people are not even aware that AI is behind it and doing some of the work and then making certain calculations or recommendations. And the third one we're concerned about is that these tools, which are claimed to be decision supporting, very quickly become decision making, not because they were ever designed for that, but because of the same factor we talked earlier about. If you're a younger clinician, maybe not quite as experienced, you are in the ER, you on at a night shift in a busy ward or have to oversee multiple wards, you you're going to be pressed for time and you're going to rely on anything which seems to be reasonable. And these AI tools, if they have not been checked for all these factors we just um, discussed, might give you a very wrong recommendation. And when you tend to rely on those recommendations, they become very quickly decision-making tools. And that's what really concerns us. And there's very, very little oversight. And again, I don't, this is not a political statement, but with the cuts the administration is enforcing, we're just concerned that some of those governance abilities go away as well. And medical devices are either not making it out of the queue, or if they make it out of the queue, maybe have less rigor. And the other problem is, as I mentioned before, a lot of these AI tools are labeled as decision support, which then requires little or no oversight from the federal government at all. And that to us is the biggest concern. We have said that many, many times that that is not an acceptable situation.